Okay, so good evening, everyone. Thank you for your patience. Today I'm here to talk to you about osteopathy, as well as what its role is with EDS, which is Ehlers-Danlos syndrome, as well as MCAS, which is obviously we know are mast cell activation syndromes. I myself am an osteopath. I've been working as an osteopath for the last 3 years. Before that, I worked in exercise prescription. Um, which has been helpful to sort of put this together today. Um, so what we're going to cover today is sort of talking a little bit about what osteopathy is, sort of how it is recognised in the UK, some of the simpler concepts around how we look at patients, and what to sort of expect in your first appointment. We'll also look at sort of that connection between EDS and MCAS, more largely from an osteopathic perspective, much more or less than a biological perspective, um, which will come a little bit clearer as we go through this presentation. We'll discuss a little bit about the sympathetic and parasympathetic responses. So the sort of fight or flight, rest and digest, um, that type of nervous system. Yeah, and sort of finish up with sort of saying about why osteopathy could be very beneficial and in which ways you can better utilize it. Osteopathy is not just massage, there's hundreds of other different applications for it. And also I might talk today a little bit about what to sort of look for in your osteopath who may be near you. So first off, what is osteopathy? So osteopathy is a hands-on diagnosis and treatment by qualified healthcare professionals. We're recognised in the UK and regulated by the General Osteopathic Council since 1993, which is a good amount of time. Typically, a lot of patients come to see an osteopath because of what we call musculoskeletal pain, as well as chronic conditions as well, whether that be lower back pain, neck pain, issues with breathing, chronic pelvic pain. The list is pretty endless. Um, Osteopathy is sort of unique compared to other physical therapies, as we sort of have our principles of health. So every osteopath will apply principles which are sort of not so much osteopathic principles as they are anatomical and physiological principles. Um, and these are basically considering that the body is a single functioning unit. So when an osteopath assesses you or treats you, they're not going, this person has a sore knee or this person has XYZ condition. We're looking about how everything is interrelated to each other. We'll see prime examples of this in a bit when we talk about stress and how that integrates how the body works. Um, Also, if we're looking at, we use a principle called structure. The structure governs the function. So your anatomy governs your physiology, and your physiology governs your anatomy. If we work in improving those, there's a better chance that it will function the way it should do. On a relatively more slightly difficult to sort of grasp or construct is rule of fluids is supreme. So blood, lymphatics, nerves all need good flow in order to work properly. The osteopathic concept sort of says that if there's congestion in these, with these blood vessels, lymph vessels, nerves, then body's not going to be able to function correctly. Treatment is basically based off these three tenets, really. So when we assess someone, we will look about how well the body is unified. You know, how well is it functioning? And where are the potential areas of congestion that could be causing discomfort? So osteopaths are available in the UK, worldwide, really. In the UK, there's around 5,000 osteopaths registered in the UK. A few osteopaths work in the NHS, normally as part of their MSK teams. So if you've seen physiotherapists in the NHS, sometimes there may be an osteopath with them as well. Most of them are private practice though, so these will be set up in, sort of sole practitioners who are set up within your local communities, maybe some multidisciplinary clinics, maybe a GP surgery as well. So you'll find us in all sort of walks of life, really. I work in mostly osteopathic clinics, myself. The benefit about seeing an osteopath in private practice is you can normally get an appointment that day, if not in that week. You've got flexibility over the type of osteopath you want to see, which we'll get into a little bit later on. The other benefit is that an osteopath gets to spend a lot of time with you. So whereas you may see your GP for maybe 10 minutes, your initial assessment with an osteopath is about an hour long. In most places, follow-ups tend to be around 30 minutes. So there's ample time to talk about what's going on with you, where is everything working or not working with you. As we mentioned, the General Osteopathic Council has a register of all registered osteopaths in the UK. Anyone who isn't on that register who's a type of osteopath is sort of breaking the law. So best bet when trying to find us is go onto the General Osteopathic Council website, and you'll be able to search your postcode or search the name of the practitioner or town, and it will come up with a list of osteopaths in the area. Some osteopaths have also done more specialist qualifications in Ehlers-Danlos. So think about the EDS Echo program that the Ehlers-Danlos Society do, and we'll often be registered with them as well. So just to sort of bring everyone sort of up to date with where these two sort of conditions sort of run in place, really. So we won't really get down into the physiology around MCAS or EDS, just really thinking about how these concepts sort of go together. So thinking about inflammation is probably one of the things that come up most that I've experienced in my clinics. And typically, inflammation in and of itself is not overly a bad thing. It's a protective mechanism. It's there to repair tissue, to improve circulation in the area. So if we think back to the rule of the artery is supreme, that's where inflammation can be very useful. The problem is when inflammation stays for a prolonged period of time, inflammation will then cause congestion. Nutrients won't get to the particular area of the body or organ as well, and so it will be working at a disadvantage. And with MCAS in particular, because of how it presents, we've got multitude of different reactions, and you've got a lower histamine threshold. It means that inflammation will become a lot more abundantly clear. Now, just quickly, chemicals like histamines and how our cells talk to each other run through our connective tissues, so our extracellular matrix. So in between all your little cells, that's where all the messages will be running around. Now, EDS is typically is a connective tissue disorder. There's, last I checked, 13 different types of Ehlers-Danlos syndrome. And that can range from just being hypermobile, to having other, a lot more serious things. So like vascular EDS is quite an important thing that your practitioner should rule out. But you'd also notice things that you'll bruise a lot easier. There's more extensibility in the skin as well. You might feel dizzy, difficulties sleeping, standing up. There's quite a lot with EDS that really sort of overlaps with a few other conditions, such as MCAS and POTS, which is, I can't remember then how, I just call it POTS. It's orthostatic hypertension. Um, so where our mast cells live in this connective tissue, if these are already loose, so they're already dilated, when we have um, you know, if the body is sitting there going, okay, well, we need to create more area, we need to open up these channels more, it's already open enough as it is. So it's just going to extend that, well, basically expand that area. So you're going to get more mast cells going into the area, and which will not be helpful for what the body's trying to achieve. And as we know, mast cells have different triggers. It can be due to lighting, it can be due to so many different aspects. I think sometimes it's quite hard for GPs to really sort of pin it down. So you'll get sent on different allergy tests and all this stuff until they eventually go, okay, yes, fine, it might eventually be mast cell. But I know the NHS is sort of getting there. We're trying to get more proper specific mast cell testing. There's a lot of work being done around raising awareness for mast cell as well as EDS. So don't worry too much about what this slide really sort of gets into. What I really enjoyed about this slide is about how everything's connected. So when we think about body unity, we just think of a simple chemical that our body produces, our histamine, about how it affects everything else. So when we're thinking about, okay, well, why do we get this? If you have your mast cells are overactive, well, it's going to release this histamine, and it can create all these different types of changes. So, whether you're getting things like vertigo, headaches, will show about how it's having an influence on your neurotransmitters. So, how your body is, registering that response. So, this one's quite a good one. If you're quite good with your physiology, it's a good one to read up on. I wouldn't worry about it too much, because I think sometimes we get lost in the amount of material available. But this was a great diagram to show how everything really connects together with one simple enzyme, really. And this isn't even considering the musculoskeletal element as well. So that sort of leads us onto our sympathetic and our parasympathetic nervous system. So I spoke at the beginning about sort of fight or flight, and our rest and digest. And typically, the way it has historically been sort of mentioned is that these systems oppose each other, and that one must overrule the other. Or if one does, then it's got to, you're constantly sort of fighting, basically fighting a losing battle, basically. The current thought process, especially in the osteopathic community, as well as physiology as well, is that it's more about them sort of creating a balance instead. So it's not really so much about one overriding the other, it's about the other one balancing out to make sure that we stay on a constant or a near constant position. We call it homeostasis. We just remain in a near constant position. So in our sympathetic nervous system, that then leads on to inflammation. So, something happens, you fall over or something like that, your body will release a sympathetic response, which will then increase your heart rate, which will then increase inflammation. It's had an incident, and no matter whether or not you're running from a tiger or you've just missed the bus. Your sympathetic nervous system's just going to open everything up, and it will cause vasodilation, inflammation, increased heart rate, increased blood pressure, and I think that's about 30 or 40 other different physiological processes. And it will do that until the parasympathetic nervous system will sit there and go, okay, that's fine. Let's bring you back. Now, with your parasympathetic nervous system, so your rest and digest, if that gets overstimulated, which is rare, but it does happen, the heart rate will slow down, blood pressure will drop, you'll have, well, your digestion won't be a problem. It'll be quite happy with that. But the body won't be as quick to respond to danger. And it's quite important that the body has that adaptability. Now, on a day in and day out basis, that's not a problem. That's what the body's designed to do. When it comes to long-term stress, so you've got mast cells that are running around the body because they've not got free rein, but they've been easily activated. I think of mast cells, it's mast cells plus caffeine when they're running amok. If that goes on for a long period of time, your ability to go into stress in that sympathetic response increases quite quickly. It doesn't take too long for your body to go, we're in a stress situation, and it will go from falling over to hearing a doorbell ring, or your your cat jumping on you, or something like that. So that means that it will really affect our autonomic response, which is these two nervous systems. So this will then, over a long period of time, start to cause the body not to function as well as it does, and it stays in this chronic state. That sympathetic response becomes its new normal. And what we as osteopaths try and do is bring that parasympathetic nervous system a little bit more up to the surface, so we can then go, okay, well, let's try and rebalance this out. Which is then, it then opens up a variety of different ways how osteopaths really work. So a bit more about sort of why osteopathy, and we've touched on this already a little bit. So osteopaths are specialists in whole person health. So it doesn't matter if you come in with, a lower back pain, we'll sort of find out what that sort of root cause is. And, if you'll find that actually you're getting headaches a lot, that's a great example of where we go, okay, well, why? Have you got any allergies? Oh, yes, whenever I go out and the sun's more than 20 degrees, my body creates a lot of inflammation. And that's always a cause for the headache. We go, okay, well, we can then follow that pathway. And because of that, we've then got that extra time to spend with patients. And most osteopaths, if they haven't, if they've got that extra time to spend with you, they typically will. Especially ones who are understanding of EDS and MCAS. I had a patient not too long ago where a new patient time, I think it was about 2 hours. If we've got that time, I think we'd spend it just to make sure that you get your story out, because it's going to help us understand whether MCAS is the prime cause, or if there's something else that we want to be testing and ruling out. Because we're health professionals, we also keep good notes. So whereas what I've sort of understood is that, people who, may suffer from MCAS or have a lot of different, more complex needs going on, they often come in with a nice big file, and it's all, we have to sit there and go, right, you're juggling 7 or 8 different appointments a month, and knowing what to say for each one can be quite challenging. What an osteopath can do is sort of help you build up your advocacy by going, right, what do we want to do for that appointment? What's the objective here? But also keep the notes so that actually, rather than you having to keep carrying around a big file all the time, the osteopath's already got abbreviated notes there so that each time you see them, you go, actually, well, the rheumatologist said this, so they're running for this test. And it allows us to keep a bit more connectiveness with it, which can understand can be quite difficult in today's healthcare system, where there is a lot of pressure and it's quite difficult to keep everything together. As we said, osteopaths can work with a variety of pain. It doesn't have to be that we've fallen over type pain. It can be neuropathic pain. It can be pain that's coming from the organs as well. Stress is definitely a big thing that we deal with almost daily, or every hour probably. But also, we can look at sort of the lifestyle advice. So how can we help support you to have the right information at hand? And also making sure that we can then raise awareness to your GP if we suspect an MCAS diagnosis and what we think, depending on the area that you're in, as to what pathway is best to take. There are a few hospitals that will have sort of triage services to then do the right testing. Again, this is still sort of becoming a bit more. I think over the next couple of years, it'll be a bit more aware. But it helps then get that MCAS diagnosis on the page as well. So we spoke a little bit about the osteopathic approach. I tried to enlarge this image to try to make it a bit more readable. I don't think it worked out too well. But when you're seeing an osteopath, you might see certain words come up, like they're a structural osteopath, or they're a visceral osteopath, or they're cranial osteopath. And you will get some osteopaths who are just one of these things. Osteopathy, though, is a mixture of these things. So it's not just about knees, ankles, and feet. Okay, it's structural. Your cranial osteopath can as well treat an ankle injury as any other osteopath. It might just depend on how they provide techniques. Your structural osteopath might do a few more manipulations, more soft tissue work as well. Your cranial osteopath is probably a little bit more gentle and will deal with a lot of headaches. Children, babies, quite often. We treat babies from probably a day old, probably. It's quite possible. But there's a different type of cranial osteopathy that will sort of work for that. Your visceral stuff will then work with anything with the chest, abdomen, pelvis, which would be quite useful for MCAS patients, because when we're thinking about organ function, how well does your body produce and absorb nutrients, and how well does it get rid of waste? And that's how we would sort of look at it from an osteopathic perspective. How well does it function? The words on here will just sort of give you sort of examples of how we would sort what sort of things we'd typically see in a practice. But it's endless what we come in. And especially with EDS, typically being the first thing that people will come in with, MCAS will sort of be something that people may think about later on, because people will have the aspect of connective tissue, which we will then work with. And it might just be through our case histories that we'll sit there and go, okay, maybe we think that there's something else going on, that we need to make sure that we can balance out. So with all that in mind, I mean, osteopathy is all about touch, sensation, how things move. And the body itself sort of works as it works on sensory afferent mechanism. So when it experiences something, it reacts. And we can look at the larger things. So we look at the tiger chasing you down the road. That's a sensory input. Your body's going to respond to that and will continuously respond to that action until you outrun the tiger. If in the same way that if your body ingests something that it doesn't like, it will create a sensory afferent system and then create a release of histamine that will then create inflammation. So everything comes back to sensation, which is a very important aspect of how osteopathy works. We already mentioned about sort of how with MCAS patients that threshold for histamine is relatively low in compared to patients that will have won't have MCAS. And this is, like we said before, is driven through that sympathetic fight or flight response. The osteopathic techniques really work on our sympathetic pathways. So we want the body's not thinking about running after the tiger and more about, oh, okay, let's just rest in that hammock and just relax. Now the single session doesn't typically, it will take normally a couple of sessions for patients to go, oh right, we've started to see that change. The patient, body's a little less susceptible to those everyday stressors. And this all depends on the patient. There's no one size fits all approach. Osteopathy is very holistic in that front. It considers the patient being the center of everything and how everything works within that. So the treatments can vary, and one treatment one week will be different than the treatment the other week because of how we assess and how the patient, how the patient is, how you are presenting each day. It will be different. Your physiology today will be different than physiology tomorrow. And what we've got to do is work out how do we make that physiology more representable of where you should be. It's not about getting a perfect position, a perfect balance. It's about going, well, what is, how far you are from your normal, what we can do to get you there. Because this low threshold for histamine is probably not something that we can do with. That's where the medical part of MCAS will then sort of come into it. What we can do is then help on those responses and how the muscles and ligaments and all everything sort of works. So when you first see an osteopath, they will typically get you just to fill out a form, which will just be your basic name, date of birth. They might ask for your GP surgery, and they might ask for list of medications. Each osteopath is slightly different how they do it. The way that I tend to do it is, we get that information first, probably talk to you a little bit about osteopathy so that you can understand what to expect from the first appointment. I would then sort of go through what the current issue is, what sort of brought you in. We'll ask about your medical history. We might ask a few other questions that may not seem relevant. So we might ask you about, if you've come in with chest pain, we might ask you about if you've had any shortness of breath, if you've, if you find that you get a lot of rib pain, that it can be difficult to cough, all these things to help us understand if there's anything else at play that we need to rule out. We might ask you about weight loss. We might ask you about your sleep patterns, particularly. And any other sort of, maybe other injuries or where did it all start? So with MCAS, the experience that I've noted with it is that it tends to sort of, when patients come into clinic, it's more about recalling this particular event that seems to have pushed that fight and flight over the edge. So it could be there's been a surgery or particularly traumatic experience, it's quite variable as to what people will come in with. You know, we'll discuss about what things make it better, what things make it worse as well. Your physical assessment. So after all that, your osteopath will then say to you, "Oh, so based on this, this is what I'm wanting to do, what we're wanting to test," and that could be a mixture of different types of assessments. So, we would want to check for things like inflammation. We might also want to check your mobility. So you might, if you have EDS, have been told to go through the Baton score of moving different joints in different positions and seeing how high you can get that rate up out of 9. If EDS is suspected, there might be another checklist that they'll run through. So they might measure your arm width. They might look at certain scars just to make sure that that there's something that we need to be piecing together. We'll then look at some active and passive movements, just see how your body's moving. We might look at your breathing. We'll see whether or not your breathing is shallow, which is quite often with a patient who has a strong sympathetic response. We tend to have a shallower breathing, shoulders up, normally get a lot of neck pain as well. Their heart rate's a little high. So all these sort of symptoms that tell us that maybe there's something worth going on with the nervous system. We'd also do some other sort of what we call the standard tests, which are things you would often see clinically. So we might check your blood pressure. We might check your neurology, see how well your body actually responds. So a patient who is very sympathetic in their responses will be quite quick on their knee-jerk reflexes. We'll also sort of look at your sort of posture in general. This will be sort of less related to MCAS as a condition, which I'll explain a little bit more in a second. But it's about us understanding sort of how well is your body coping? How well is it dealing with just standing there? If we're finding that the body is struggling with that, well, that's a stressor. So what we need to try and do is what can we do to make that posture easier so that the body isn't under strain? When we look at, it's understanding really how your body's coping. And when people come in, they might have their bodies hunched over, they might be limping, and they might have all different sorts of things. And we've just got to understand from point A, how does that feel? Once we're happy with that, they might then do these active assessments to see how well it loads under stress. Some of the tests might be a little bit provocative depending on what you come in for, but your osteopath will tell you what to expect and what they're expecting to find from this. So once they've done all this, they'll run through the next part, which is telling you what we think is going on. So if, for example, you have been diagnosed with MCAS and EDS and it's diagnosed, well, we wouldn't have had to reassess all that. We would take that for what it is, unless there's something in the history that doesn't quite make sense. Osteopaths are quite curious, so we will tend to over-test just to make sure that we've got a good idea of what you're experiencing. If it's not been diagnosed, we will probably write a referral letter. Doesn't mean that we can't perform treatment. It just means that we want to get the GP involved and to know that we've looked at this and we think that this is a possible diagnosis. A diagnosis now, depending on how much you really want to discuss with your osteopath around a diagnosis, you always have sort of like a tissue causing symptoms. So, we've got lower back pain, and it will say because this structure's the issue, or we've got rib pain because of an issue with how our bodies are breathing because of the stress response. You will occasionally, depending on the osteopath, have what we call an osteopathic diagnosis, which is about a paragraph long of every single mechanism involved from what we've seen. It's a lovely read, which is great fun. It's also fun to write, but it will then sort of tell you exactly where you are presently, what we think's going on, what's predisposing you to this particular symptom or this complaint, what's preventing it from getting better. So what the barriers to that is. And, we look at MCAS. MCAS is an inflammatory condition, so there is autoimmune. So we know that that's going to be a barrier for some healing, not all, but some. And we know that we need to then find a way to remove that barrier or dampen it so that the body's own mechanisms can become involved. So once we've sort of spoken about the diagnosis, and if we have done a referral letter and it's a non-urgent one, so MCAS and EDS are classed as non-urgent in terms of you're going to live through the day, that's fine, unless it's vascular. So if the practitioner thinks it's a vascular form of EDS, they might not treat you that day. They might want to get a bit more information, a bit more testing done first. The safety of the patient is always the first thing we look at. In many ways, this whole case history is this patient safe to treat or not? So when we look at osteopathic treatment, there's different ways that we can sort of look at it. Different types of techniques are always there. There be joint mobilizations, so passively moving these tissues around, especially if we're looking at rib mechanics, which we tend to do quite a lot of with MCAS patients. It will be a lot just gently moving tissues around until we can find, actually, do you know what, that's starting to feel easier now. The body's beginning to relax into that. You would have seen probably on Instagram or any YouTube or anywhere about manipulations, and it's regarding if it's safe to do for the patient, which is where that case history will be. If you suffer from osteoporosis, if you're really hypermobile, is there something else going on? Is there a cancer or anything like that? Things like manipulations is not something that you would do. If you've looked at all those red flags and there are none, then as long as it's safe and you as a patient, consent to it and they've told you about any potential risks, there are some small risks involved in manipulation, then it would be safe to do. They will do soft tissue work, so that may include lymphatic drainage. So if we think about your inflammation, we're thinking about congestion of fluids, obstructions. Lymphatic work is great for helping to remove those obstructions, which is quite a useful thing to do. And osteopaths will typically teach you how to do your own form of lymphatic drainage if you don't know how to do that already. Then we've got sort of the cranial aspect, where it's very subtle work, working on how well cerebral spinal fluid flows, and again, that parasympathetic response will become sort of the mainstay of that treatment. So it's very effective as well. We'll also give you a variety of different advice and exercise depending on what you value and what you need. It won't be you'll be given a list of 20 exercises, and in many ways, if they exercise is a trigger for your MCAS, we might discuss about ways to make that more. How do we look to increase the tolerance of that? And that's where probably the GP, maybe a rheumatologist, might be involved in that aspect, as well. And like we said, everything sort of varies on the diagnosis, especially the osteopathic one, your history and your preferences as well. So really sort of looking at this sort of in summary, they're osteopaths, they're primary healthcare professionals. So you don't need to get a referral to come and see them. You can literally just self-refer. You can turn up on their doorstep if they're not busy. But I would say book in an appointment or at least get a phone consultation with them just to understand whether it's the right fit for you. We diagnose a huge range of pain-related disorders, um, and that again is just quite a limitless list, really. Our goal is to get you back to health. So if we need to get you back to your normal symptoms that subside, brilliant, amazing. Because of our sort of more holistic approach, we can deal with complex cases. So EDS and MCAS on their own are complicated conditions anyway. Osteopaths, because of the way how we think about how the body works as a unit, we're then able to then sort of bring that back and simplify it a little bit. Lastly, we'll be able to also help you aid with appropriate referrals through your GP. So it means you'll get a quicker diagnosis. You'll be sent to the right pathways rather than getting sent to the same chronic pain unit. We might be able to find one that's a bit more appropriate for EDS, or someone who's got a real specialty in MCAS. Osteopaths are great fountains of knowledge for finding the right people. So hopefully today's been a bit of a information dump, probably, but giving you a kind of nice sort of overview of a little bit about what osteopathy is about. It's very variable one osteopath to the next. But I think that's something that's to be celebrated rather than not be. And it's about finding an osteopath that you're going to connect with, that is going to understand your condition. We listen, not just through our ears, through our eyes, through fingertips, anything that we can do to make sure that we can find you as a patient back to health. I think that is everything. I have no idea what the time is, but yes. Well, thank you very much for listening. Yeah, I'll hand you back to
Uh,
Therese and go from
Hi,
there.
Rory.
Hello.
Um, Thank you so much for that. That was great. We are at 5 minutes to 8.
Yeah.
I can see that there's some questions in the chat. Do you have time to go through some questions?
Yes. Yeah. I was just
Yeah,
seeing if I can
brilliant. Do you want to
find
stop
them.
sharing and then hopefully we'll be able to see your face finally?
Yes, that would be a good thing. Yeah. It's the ominous voice. All right, give me a second. Right, there we go.
Yay, we can
There we
finally
go.
see
You can see
you.
me. Yeah.
Yep, so I'm not going to read out anyone's names or anything, but there's some questions in the chat. So the first one is, do osteopaths take the HPA axis into account in their treatments?
Oh, yes, they do. Yeah. I mean, HP access definitely. Um, yeah, that's normally quite a primary one that sort of comes up. Yeah, to be fair, we sort of take in everything. So osteopathy came from using the science of what was going on at the time and basically building a treatment plan through that. So osteopaths constantly look at what the current research is saying, what the experts are saying as well, and sort of using those sort of models.
Great. Thank you. So we also had which types of osteo treatment help bring more para and sympathetic balance?
So cranial osteopathy is probably my go-to for that. I mean, all of it does in one way or another. But I find cranial because it's about gentle movement. I mean, really gentle. I mean, sometimes patients end up falling asleep more often than not. Um, so that's the one that would be more parasympathetic. Other ones, manipulations slightly less so. Um, Unless they're done with cranial, has been my experience. I find for me, I end up doing manipulations first early on if I need to, and then I'd always finish with a good 20 minutes of cranial work, because that seems to be much more beneficial.
Great. Thank you, Rory. Somebody said that's fascinating about the fluid aspect. Do you notice facial and orbital swelling may be caused by MCAS?
Yeah, I mean, in my experience, I've seen a couple cases where that has been the case. It's about understanding sort of where fluid buildup is, and you've got a body that's just filled with so many different pathways. We've got to really work it out. I mean, if you're getting orbital and facial swelling, we've got to work out the why. And it could be MCAS, it could be actually you've got a lack of lymphatic flow, from the face. That could be the issue. It's about working out the why first, but it could be.
Um, Someone said, how do you treat the fascia in those with heads?
Um, so I treat it very in a similar way. I don't really use long range, like what we call long lever techniques in heads. So hypermobile EDS. Um, I more use sort of mid-range short lever techniques that have less of a probably look a little more boring, but they're a bit more you know, we've got a shorter position to go into. It depends on the patient. I've had some EDS patients that are so flexible that um, you know, I will just sit there and go, right, well, we're going to use what we call muscle energy techniques. So we're going to get the muscle to engage at mid-range and then relax it and then re-engage it through there. So you can work with fascial unwinding. It is a little bit more tricky, which is why it's good to have an osteopath who has EDS, who's done the EDS Echo course, just so they've got a better understanding, really.
Thank you, Rory. Somebody said, what sort of osteo treatment would help to reduce histamine?
So histamine is sort of stimulated by your sympathetic nervous response, the sympathetic nervous system. So, that's its sort of driver. So what we need to do is to create that sort of parasympathetic outflow, really. So basically going back to the cranial stuff seems to be what I would seem to advocate more. In terms of technique, we would also look at other things. So is there things that we can do about changing your hydration, look at nutrition, look at how we improve in sleep, just to really promote that parasympathetic outflow.
Thank you, Rory. So I'm trying to get through all these as much as we can. So someone said,
Yeah.
lymph, also very interesting. Do you notice areas of lymph swelling, aching, and or severe tenderness in MCAS? And how can this be addressed by osteopathy?
So, I mean, lymphatic work, I mean, it's in many ways, it's what we sort of do day in and day out because it's or it's congestion really. Now, there's never really specific areas that will be particularly swelling because every patient is different. Every person's experience is very different. Getting a bit philosophical there. But not really noted anything that really is a severe tenderness in MCAS. It's more in relation to you know how quick is their body, their immune system responding to things that otherwise should be quite fine. Um, how would it be addressed by osteopathy? There's we didn't mention it today, but there's a technique called body adjustment, which is a more of a classical osteopathic technique. Been there for a very long time, and that really helps in easing up the lymphatic system. Um, you'll go from head to toe, working through every joint to free everything up
Okay, the same person asked, do you write to doctors about a patient?
with your consent. So typically, what we do, so I often just write a letter and then give it to the patient. If they're feeling that they're not really feeling that confident to do that, then I'll do with their consent. I'll write a letter to the doctor, normally copying them in with the patient with that, just to make sure that you've got your consent, because that's the only time that we would write directly to a GP. Typically, we can write a letter. It's medical legal, so if we write a letter, your doctor can't ignore it. It will have to go into your medical record, which is an important thing when it's coming up with MCAS. Is getting that trail of paperwork so that they can go, oh, it's not just the osteopath who thinks this is MCAS. Maybe the GP is thinking this too, and so that's the important thing around writing letters. But it's always with the patient's consent.
That's really helpful to know. Someone's asked, how does an osteopath differ from a naturopath?
Do you know what? I don't quite know. Naturopaths tend to be more sort of nutritionally based. They're more find on the healing of nature, so there's a similarity in that. Osteopaths are a little bit more sort of around the the, the connective tissue. Early osteopaths were very much um did a bit well did a bit both. John Martin Littlejohn helped, I believe he did actually form a college with the naturopaths and osteopaths. So some of them, there's a really good one in North London. Irving Boxer, he's my mentor. He's both an osteopath and a naturopath. So they go really hand in hand. Um, just think an osteopath's a bit more hands-on, but that's just my sort of maybe my bias on that, maybe.
Great, that's really helpful. Someone's asked the same question about the difference between osteopathy and chiropractic because you
Uh,
use the word manipulation.
yes. So my, I mean, osteopaths and chiropractors are very different. Um, Chiropractors actually were, well, if you read the history of it, um, chiropractors actually originally started off as from osteopath schools and then went off and did their own thing. Um, Chiropractors tend to be more about just really about spinal alignment and basically around that really. You know, they would say that the spine is the center of everything. Osteopaths say that the body is the center of everything. So if one thing's not working, it's going to have an effect on everything else. Um, so we have some carryover in techniques. Obviously, I've got a little bit of a bias towards osteopathy, but typically osteopaths are also allied health professionals. So we're recognized by the NHS as health professionals, whereas chiropractors are complementary therapists. So when things happen like lockdowns, you can still see your osteopath, you can't see your chiropractor. Um, yeah, that's basically probably the main sort of difference between them.
It's really handy. Are you okay to continue for a little
Give
bit
us,
more,
give us a
Rory?
couple.
Because we've gone
Yeah,
over. Just wanted to check.
yeah, fine. Yeah, um, yes, yeah, fine to
There's a
answer a few more
few more
questions.
questions. Yeah, we won't answer any more that have been posted. But I think we could probably get through these ones. The slides will be uploaded onto the website and the recording will go onto the YouTube because I know somebody was asking about the slides. So they'll
Yeah.
be in the resources section on the website. Someone said, um, what is HPA axis?
So the HB axis is the hypothalamic pituitary adrenal axis. So it's your body's central stress response, basically. So this will be that element of fight and flight, how it responds to situations. Um, from a from that pituitary adrenal aspect, really. Um, I mean, you can get quite with the physiology, you can end up getting quite bogged down with all the different axes and different pathways, and I mean, different medications will affect different aspects of these pathways. But that's essentially what it sort of is. Osteopathic Osteopaths do use it. Um, it depends on sort of how they sort of view things, really. Um, I tend to start with the fight and flight responses, and then maybe we get into other things later on, like central sensitization and all these other wonderful things that comes out of the scientific community.
All right, thank you. So someone said, can you get a session non-local with an osteopath through the primary healthcare elsewhere than Norfolk?
Than let's say Norfolk. There's some good osteopaths in Norfolk. So yeah, I mean, Can you get a session online called an osteopath through primary healthcare? Maybe depends on the if I think it's your question about the NHS. Um, it it depends on the commissioning group. It depends on what they're saying you can do. Um, otherwise, you know, yeah, otherwise it's about just finding osteopaths in your local area. There's some good ones in Norfolk, um, for example. But we're around all around the UK.
So someone
So
said,
hopefully that answered that question.
someone said, how do you treat people who have stagnant digestion or CNS or spinal cord conditions linked?
Ooh, very,
Linked
very,
meaning MCAS, POTS, EDS.
so I mean, again, it's about looking at those principles. So we would sort of look at a patient and how well are they not aligning with those principles, and you know, if there is issues with the CNS, I mean, the central nervous system, that is, it would then be through this parasympathetics, so your rest and digest, which is as well as a stagnant digestion. When your body's in stress, it doesn't digest, and that rhymes there. So what we need to do is improve parasympathetic outflow. Um, we can then probably do some visceral techniques around that. Spinal cord conditions, it depends. I mean, you know, it will be then sort of breaking that down and going, right, well, if a spinal cord condition like a cervical myelopathy, probably not so much we can do with because that would be a surgical intervention. Um, yeah, because there's not much we can really do with that. But if it's, and again, spiral meningitis, that's something that needs to be a medical go and sort that out, and we can go from there. Um, it's really about applying the principles. So the condition doesn't really matter so much. It's about how is it affecting the physiology and what we can do to influence it.
Great. Maybe we'll go just till 10 past. So someone's
Yeah,
just
that's fine. Yeah.
asked about what qualifications an osteopath needs.
So osteopaths at the moment are trained up to bachelors. Well, their initially entry levels is bachelors, so 4 years, 1,000 clinical hours. Most of them are trained up to master's level, so I've done mine up to master's as well. So you'd always have to do a 4 year undergrad. Um, the EDS Echo program they tend to run. I'm doing another section now. Tends to be about a year or so. I think I've sort of added it up because you'll see it in sections. You'll do 3 or 4 months every week, then take a couple months off and go back to it. But it's a really good course if you're a health practitioner. It really does help open your eyes up to how all these systems start working together, really.
Great. Someone said, does the body adjustment method mentioned tend to be suitable in those with heads?
Yeah, yeah. I mean, I something I use quite a lot with heads. Again, it's we hypermobility. Well, actually not again because I haven't mentioned this. There's so much to mention. The thing is that if we're hypermobile and there's something that's not mobile, everything else has to work a lot harder to compensate. So osteopathy would then work to loosen that segment up, and not about making you stiffer as a person. Your body's naturally wanting to be hypermobile. We just want to make sure that there's less strain on the body as possible. Congestion will then cause a strain. So body adjustment can do, and body adjustment is only really done with classically trained osteopaths. So you'll have to look at the Institute of Classical Osteopathy to look at a list for those. Um, typically, that's what I would advise. Um, yeah,
Thank you, Rory. I think we might have to leave it there.
yeah.
I
I
know
thought
there
we
are
had,
some questions that we haven't
yeah,
answered. I don't know how
well,
you'd feel about if people emailed them in to the
yeah,
events.
yeah. That's fine, no problem. In regards to
Yeah?
the one about Irving Boxer, he's not, but he's my mentor. So I've spoken to Irving quite a lot. So he'd definitely be, yeah, very good. But yeah, I'm happy to answer any questions over email. That's not a problem. Might give me a day or
Amazing.
two to reply to them. But yeah,
Yeah, yeah, Rory's very busy, helping lots of people. So yeah, we can pass on questions to him, but we will get them back to you when he can have time to answer them. Thank you so much, Rory, for hosting. Lots of people are saying thank you and that it was excellent and they've learned a lot and I've learned a lot. So thank you so much for joining us tonight. If you did
No
have a
problem.
question that didn't get answered, please email. I've put it in the chat, events@mastcellaction.org. And yeah, thank you everyone for coming. It's lovely to have you here.
Right. Right. Have a good evening, everyone.
Take care, everyone.
Yeah.
Bye.
Bye.